Hello, I'm Zubeyde Akdas from iMed Medical. In this video, we're gonna answer some of the most common questions about facial feminization surgery, also as known as FFS. This is not a procedure people research lightly. For many trans women and gender affirmation patients, FFS is not only about the facial structures, but it is also connected to the identity, confidence, daily life, safety, comfort, and the feeling of being recognized more accurately. Also, some of the cis women are also looking for FFS surgery to make their face more feminine. So today we will talk about FFS with care. We will explain what it may involve, which areas of the face can be addressed, and how the surgical plan is created, what kind of recovery looks like, and what patients should be considered before making a decision. The answers in this video have been reviewed and approved by plastic surgeon Dr. Turgut Kayadibi. Our aim is to give clear, respectful, and realistic information. So not to rush anybody, so not to rush anyone, and it's not to make anyone to feel that the surgery is something they must be do. Please remember, this video is for general information purposes only, and it doesn't replace a personal consultation, diagnosis, or treatment plan. Your suitability, possible risk, and the surgical planning must be evaluated individual by Dr. Turgut. So let's begin gentle with the first questions.
What is facial feminization surgery?
Facial feminization surgery, often called FFS, is not only one surgery. It is a group of surgical procedures combined that may adjust your facial structure and the soft tissues to create features that are generally perceived to be more feminine. Depending on the patient, FFS may involve areas such as forehead, the brow bone, the hairline, the nose, the cheeks, the lips, the jaw, the chin, and your Adam's apple. So there's no standard FFS package that fits for everybody. This means also no standard price package. Every face is different, so every patient's goal is also different. So a good FFS plan should be built around your own anatomy, your identity, your priorities, expectation, and of course safety. So it's not a fixed list of procedures and also not a fixed price.
Who is FFS for?
FFS is a most commonly concerned for trans women, cis women, and gender diverse patients who feel that changes in their futures may support their gender identity and their daily life. For some patients, it may be being more redecorated by others. For others, it may be feeling more comfortable how they look in the mirror and how they feel. Both reasons are valid. In this video, it is mainly prepared for trans women and cis women and gender affirmation patients, but some procedures may be also discussed for other patients who want a facial refinement surgery. The most important point in this one, FFS should be a personal decision and not something done because of pressure from other people of comparison online. So never look online on social media for how do you want to look alike.
Which areas of the face does FFS typically address?
FFS may include different areas of the face, depending on the patient's anatomy and the expectations. The common areas includes like the forehead, the brow bone, because the upper face can be strongly affected by the gender perception. The hairline may be addressed if it is the position, maybe you have a big forehead. And also the shape of your hairline can create a concern. The nose may be refined with rhinoplasty. The cheek can be enhanced or reshaped. The jawline and the chin may be softened during contouring. And don't forget the lips. They can be adjusted in selected parts. And not to forget the Adam's apple can be reduced with a threshold shave. But not every patient needs all these procedures. A good plan is not about doing more. It's more about choosing the procedure that feels sense to your face, expectation, and don't forget the age.
How is an FFS plan created?
An FFS plan is created through a detailed evaluation by Dr. Turgut and also to listen clearly what you want to achieve. Dr. Turgut evaluates the facial bone structure, the soft tissue, the skin quality, the symmetry, the proportions, and how the features work together. By planning FFS is not only technical, the patient's own properties matters deeply. Which features may cause the most discomfort? Which features does the patient want to keep? What kind of change should be more authentic rather than artificial? Measurements, photographs, and sometimes imaging can help. But a complete surgical plan should be not created by only a few messages and pictures that you are sending. Please inform us clearly what you want to achieve and what your expectations are. The FFS planning needs time, detail, and respect.
Do all trans women need FFS?
Absolutely not. FFS is not required to be a woman. It is not required to be in transition. And it's also not required for somebody's identity to be valid. Some trans women want FFS very deeply. Some of them want only 1 or 2 procedures. Some never need a facial surgery at all. All these choices are valid, and we have to check what your expectations are and what you need. The decision should come from your own needs and comfort, and not from the outside pressure, beauty standards, or the idea that there's only one correct way for the transition. There is no single correct path. Your transition belongs to you and only to you.
What is the purpose of FFS?
The purpose of FFS is to help bring facial feature into closer alignment with your own gender identity. For many patients, this can support comfort in daily life, reduce the gender dysmorphia, and help them to feel more recognized in their own reflection. But it's also important to be honest. FFS can be deeply meaningfully, but is not a solution for every emotional challenge that you are facing. It doesn't control how every person in the world will see you. Also, it doesn't control how you will see your own mirror reflection. It doesn't replace emotional support, community, or mental health. So, FFS can be an important part of somebody's journey, but it shouldn't place under the pressure of solving everything.
Is FFS performed all at once or in stages?
FFS can be performed in one combined surgery or in stages. It depends on the number of the procedures planned, the patient's health, the anesthesia safety, the expected surgery time, the recovery capacity, and the personal circumstance. Some patients prefer a combined plan because they want main recovery period. Some benefit from stages procedure because the plan is extensive because a slower process feels safer and more manageable. Either options are automatically better. The right approach is one that is medical appropriate and emotional manageable for the patient. But also, aging is also a factor. When you age and you already had an FFS surgery before, maybe with aging you need a second round of FFS.
What type of anesthesia is used?
FFS is usually performed under general anesthesia. This means that the patient is asleep during the surgery. Because FFS may involve several procedures in one surgical session, anesthesia planning is taken very seriously. Before the surgery, the medical team reviews the blood test, the medical history, medication, the hormone therapy, if applicable, and the health factors that may affect the anesthesia and recovery. In some cases, additional evaluation may be requested, like an extra consult with an extra doctor. So anesthesia is not a small detail in the FFS surgery. It is a part of the safety planning from the beginning. So be honest when you give your all medical information to us.
How long does FFS surgery take?
The duration of the FFS depends on what kind of procedures are involved. It is not easy to say, so first we need to make your treatment plan and then we can say how long it will take. A single procedure can take maybe a shorter time, but a more comprehensive FFS plan involves with the forehead, nose, jaw, chin, facial shaving may take several hours. In many cases, combined FFS surgery can last like a few hours or a full circle session, depending on the plan. The main priority is not the speed. The priority is safe anesthesia and a plan that matches to your needs and expectations. The exact duration should be considered during the surgical planning.
What should patients expect immediately after surgery?
Immediately after the FFS, patients are monitored closely by our medical team in the hospital. Swelling, bruising, tightness, tiredness, and discomfort are all expected. The face may look different in the first weeks, and it can be emotionally intense. It is important to remember that the early post-operative appearance is not the final result. You are never get ready directly after the surgery. Some patients may feel emotional, overwhelmed, or impatient during the first stage of healing. It is completely understandable. The early recovery period is about safety, rest, swelling control, and allowing the body to begin healing. So be patient, it takes time.
What is the recovery process like?
The FFS recovery is significant, and patients should be prepared for that. The first week can include swelling, bruising, fatigue, restricted activity, wound care, a soft food diet in some cases, and frequently follow-up aftercare instructions. The healing is not always smooth by day. Some days you may feel better and some days you feel slower. Also, the swelling can be getting back and up. Some patients are going through an emotional adjustment period because the facing is healing, changing, swollen. Also, when you go to your toilet and you wash your hands, you look automatic in the mirror and you see what I call tiger face, but this will go away. So be patient the first months. But don't forget, recovery is not only physical, it can be also emotional. So having the support, patient and realistic expectation can make this period easier for you.
How long until the final result is visible?
FFS results may take time. Some changes can be seen early, but the face needs months to settle. Swelling decreases gradually, tissues are softened, scars are mature, facial expressions begins to feel very natural again. For many patients, a clear result is visible about 6 months. In some procedures, especially when we do bone work or larger combined surgeries, the final refinement can continue up to 12 to 18 months after the surgery. This timeline can be emotional, difficult, because patients they want to see immediately the final results quickly. But with FFS, patient is part of the process. The face heals slowly.
Will there be visible scars?
Any surgery we are using incision and it can leave scars. In FFS, Dr. Turgut usually tries to place the incision in less visible areas when possible, such as inside the mouth, inside the hairline, along the natural facial lines like the under eyelid correction. But some procedures like the threshold shaving or certain hairline approaches like the hairline reduction surgery may involve incisions in more visible locations. Scar appearance depends on the incision placement, your skin type, genetics, smoking, sun exposure, and the post-operative care. So patients should be informed clearly about where the incision will be placed and how the scars care should be managed after the surgery. So be aware and ask clearly to us.
Does FFS affect facial sensation or expression?
Yes, it can be, especially during the healing period. FFS involves area close to the nerves that affects sensation and facial movement. Temporary numbness, tingling, tightness, or asymmetry can happen after the surgery. In many patients, these changes improve gradually over months. Permanent changes are less common, but they are possible with any facial surgery. This is why surgical planning, anatomy knowledge, and the technique is also very important. The goal is not only to change the appearance, but to protect the final facial function as much as possible.
What are the possible risks and complications?
Like every surgical procedure, FFS has possible risks. These may include bleeding, infection, swelling, bruising, delayed healing, visible or uncomfortable scarring. What else? Asymmetry, change in sensation, changes in facial movement the first month, anesthesia-related risk, and dissatisfaction with the results. There may be also risk-specific risk to each procedure of the FFS plan, such as forehead contouring, jaw contouring, rhinoplasty or threshold shave, smoking, medical conditions, medication, hormone therapy, and the post-operative care may all affect the risk. This is why the informed consent form shouldn't be rushed. We are sending in front to you so you can read it carefully at home. Patients should understand the benefits, limits, and the risk before deciding the surgery.
Are there special considerations for patients on hormone therapy?
Yes, of course. Many trans women are using hormone therapy, and this is a very important part of the medical history before the surgery. The medical team needs to know exactly which medication you are using, which hormones you are using, including the dosage and the timing. In some cases, the surgeon or the medical team may recommend a temporary adjustment before or after the surgery, depending on the health of you and the risk factors. There is no single rule that applies to every patient. It is very important to be fully honest with the medical team. Patients should never hide their hormone therapy, medications, supplements, medical conditions, bad habits, don't forget, because this information help protect your safety.
Are FFS results permanent?
Some structural changes made during the FFS, especially bone contouring, are long-lasting. For example, changes to the forehead, jaw, and the chin structure are usually considered stable once the healing is complete. But the face is still continue to age. Skin, fat, muscle, soft tissue change over time, like they do for everybody, unfortunately. Weight changes, sun exposure, smoking, lifestyle, bad habits, and a natural aging may affect how the face look in the future. So maybe you need a second round. So FFS can create a long-lasting surgical changes, but it doesn't freeze the face in time. I wish that we had this kind of option.
What kind of aftercare is required?
Aftercare after FFS is very important. Depending on the procedures that are performed, patients may need to sleep with the head elevated, follow wound care instructions, eat soft food for a period, avoid intensive physical activity, protect incisions from the sun exposure, attend maybe consultation or visit if it's possible in Istanbul, and watch for warning signs, explanations, and watch for warning signs explained by Dr. Turgut. But FFS aftercare is not only physical, the emotional side matters too. The early healing phase can be vulnerable, especially when the face is swollen and changing. Support from trusted people, community, and mental health profession can be helpful during this time.
What should patients consider before deciding on FFS?
Before deciding on FFS, patients should take time. First, think about your motivation. Is this something that you support in your life and comfort, or is it coming from pressure? Second, understand the limits. FFS can create meaningful change, but it cannot control every social experience or solve very emotional difficulty. Third, prepare for the recovery. Take time off from work. Emotional support, financial planning, and realistic healing timelines methods. 4. Choosing your medical team carefully. Experience with FFS and respectful care for trans patients are extremely important. A good FFS decision should be informed, supported, and unhurried. Be aware that we are LGBT community pro clinic agency, so you can feel very comfortable with us. FFS is not only about changing visual factors. For many patients, it's about reconstruction, comfort, safety, and feeling more at home in their own reflection and body. This is why this decision deserves time, respect, and honest information. If you are researching about FFS, please don't rush yourself. Ask questions, take notes. Think about what matters to you, not about what everybody is saying about your journey should look like. If this video helped you understand FFS more clearly, you can subscribe to our channel and watch our other videos, where we explain aesthetic and general information procedure in a careful and realistic way. And most important, your personal suitability, possible risk, surgical plan should be always evaluated by Dr. Turgut Kayadibi. Thank you for watching, and please take care about yourself. Bye!